Well, good morning and welcome. We are in our second series of the homeless issues in Monterey County and San Benito County. With this series, we plan to have 6 or 7 different webinars that will educate our community on the issues around homelessness and what's going on and how we can help address some of those issues as a community and as individual agencies. So on behalf of Community Homeless Solutions, which is the largest provider of homeless services and housing in particular and shelters in the county, we want to welcome you. We serve about 300 plus people every night, individuals, families, and even those recovering from acute care stay. We'll find out a little bit later in hospitals. Each seminar, as you know, will feature little different topics, and again, we are making these very fluid. So as we go along, we're inviting guests and experts in that have particular expertise in the areas that we'll be addressing. So coming up, we'll be addressing, for example, domestic violence. We'll talk about housing issues. We'll talk about COVID impacts and how that's impacting shelters and funding and everything else. And then kind of what's the future and how can our community be more involved. So my name's Eric Johnsen. I'm Vice President of the Board of Directors with Shelter Outreach Plus and have been in that capacity for over 10 years. We just celebrated, as Community Homeless Solutions, our 100th anniversary about a year and a half ago. 40th anniversary. Now, 100, boy, I think I've been alive. No, I'm kidding. But our 40th year of service, and it's grown and grown and grown. We're an agency now that probably has about $4 million in revenues from different services we're providing, and very happy to do that. Today we're joined by 2 very special guests who work for Community Homeless Solutions in different capacities. Our first guest is Ms. Valerie Garcia Martinez. Did I say that right? Pretty good, huh? All right. Valerie happens to oversee and run our respite care program on behalf of the agency. We call it Central Coast Respite Center. And she'll talk a little bit more about what that is. Welcome, Valerie. It's great to have you with us. And then Christina Soto's with us. She's been with the agency for quite some time. She actually began with us running our Hollister shelter over in San Benito County, but she has proven herself extremely valuable in the shelter arena and put in place some really great ideas around how to run shelters and some creative ideas to get people off the street. So Christina, thank you. Welcome. She also does a lot of our special projects on behalf of the organization. So a lot of our new startup things that we're involved with, which have been a lot this year, haven't they, Christina? So before we get started, just a couple quick logistical items. First, each episode is going to be taped and will be posted to the Community Homeless Services website, Community Homeless Solutions, and there's a particular seminar page there where they'll all be listed and set up. Then you can go and view them really at any point in time. We expect this particular tape will first air on September 7th, but be available from that point on. Secondly, if you have some questions that you want to submit or ask, you're welcome to do this. You can submit them to info@communityhomelesssolutions.org. And if you do that online, we'll be happy to review those. And we also post, by the way, additional resources online that people can go to get more information about some of these issues and topics we're talking about. And finally, as I mentioned in our prior webinar, if you need to use the restroom during the webinar, go ahead. I don't have any control over that, but I can't help you otherwise. So good luck. And without further ado, we're going to jump into this very important topic. Ladies, thank you again for joining us today and welcome. I look forward to a fruitful dialogue together. Well, as we start this morning, we're going to go through a series of different topic questions, but why don't we just start off by you introducing yourself and talking a little bit about each of you about the area that you currently oversee and some of the things that you're responsible for the organization. If you would mind do that. Christina, why don't you start us off?
So my name is Christina, and I am currently the Special Projects and Salinas Swarming Shelter Manager. I've been at Community Homeless Solutions since 2017, and I started out at the Home Resource Center in San Benito County.
Good. And Valerie, tell us a little bit about what you do right now.
Good morning. My name is Valerie, and I have a background in social work. I've been with the agency since Central Coast Respite Center opened its doors in 2016, and I am also the Central Coast Respite Center coordinator as well as case manager.
Super. Well, thank you. So we'll start with a little bit about the shelters, if we might, Christina. Maybe you can give us a quick overview to start of all the shelters that we have currently in Monterey and San Benito County, and approximately how many people are served in each of those shelters, and then we'll talk a little bit about some of the others from some of the other agencies as well that are in our county.
So currently, Community Homeless Solutions is the largest agency that has shelters throughout Monterey and San Benito County. So in San Benito County, we have the Home Resource Center, which is now a 24-hour shelter, and it shelters 50 people, 22 females and 28 males.
And that's located in Hollister.
In Hollister, California, yes. And it's actually located in a great place because it's right next to social services and the bus routes for people to be able to get any type of support services that they may need.
Excellent.
We have the Salinas Warming Shelter, which is located in downtown Salinas, and that houses up to 90 people. So we have 70 inside of the shelter right now, and then we have 3 families that are in the 3 trailers that we have that are equal to 20 people out there.
Great.
We are also open 24 hours a day, but we do prioritize who comes into the shelter. It's families, single women, and males. Currently, right now, we do have space and are accepting any of the 3 into the center
Great.
between 9 a.m. and 7 p.m. every single day.
Okay, good. So
we-
total 90 people capacity there, and a lot of them have been there for quite a while now because of the quarantine and the COVID
Yes.
shelter-in-place orders, right?
Yes, but I'm happy to say that in the next coming months, we will be hiring housing navigators that are going to be assisting our families to be able to find housing. And I'm also happy to report that last week we had 2 families housed.
Excellent.
So it is opening up more space for more families and individuals to come in.
Super. So that's a Salinas Warming Shelter. What else do we have?
We also have one of our newest facilities, which is the Chinatown Navigation Center. Currently, right now, they're able to shelter 16 people, but later on we're going to be taking a tour as to where we're going to be putting up the sprung shelter. So the sprung shelter will be able to shelter 50 individuals, and then there's also going to be trailers, also very similar to the ones at the Salinas Warming Shelter, that are going to house about 5 people per trailer. So the capacity here will be 75, and construction will be starting in October.
Super. And for those who don't know what a sprung shelter is it's a canvas, obviously a canvas structure supported by aluminum frames with lots of bedding and bunks and everything
Correct.
else, and supportive services inside.
Correct. So they are going to be having housing navigators. People are going to be having housing plans created. It's actually going to be termed as a bridge housing, so that it does not affect their homelessness status as soon as they find somewhere to be.
Great.
And that's in partnership with the city of Salinas.
And that will start, as I understand, with a few less people while we have appropriate COVID separation and all that until we get through that crisis, and then we'll be able to have full capacity, hopefully sometime in the spring if all works well.
Yes. So I know that the sprung shelter will only be 25 beds. Also, the Home Resource Center is only at 25 beds as well. The Salinas Warming Shelter is still at their 80 capacity.
Okay, so we've hit Collister. We have 2 shelters, one existing, one that's coming in Salinas. Where else do we have shelters?
We also have our domestic violence shelters. The one here in Salinas is our Natividad shelter, and that works with women and children who are found in any type of domestic violence situation. And the survivors there are able to stay there. They get supportive services, they get counseling services, and then hopefully we'll find permanent housing to be able to exit.
Excellent. I think we found historically women tend to be quite a bit more resourceful than our homeless men. Tend to get housed quicker. They tend to snap to it, take care of the kids, anything else, just to immediately manage their crisis situation. So that actually has a pretty good turnaround as well in terms of ladies that are able to get housing and move on and get in a stable situation, which is terrific. So.
Yeah.
And then we have another similar one over in
Marina, which is our Hamilton Center, which is also a DV shelter as well. And they also provide the same services, case management, therapy services, help them find jobs and housing to hopefully be able to start their next chapter of their life.
That's terrific. So, well, thank you. That's a great overview for others. There's other agencies as well that have different specialized type of shelters in the community. That I just mentioned them as well. YWCA has a couple safe houses for domestic violence victims, and those are tend to be on the Monterey Peninsula in hidden locations, which is great. Community Human Services runs their Safe Place youth center for 18 to 24-year-olds. I guess they have 12 slots, as I understand, in their program. In November, the Gathering for Women and Community Human Services are teaming up to open a shelter in Seaside. I understand that will house somewhere around 40 women, primarily women at that shelter, especially women and kids if they have some, but hopefully that'll get open in time and provide some services on the peninsula. For those who have heard of the iHelp program, that's a program that actually Community Homeless Solutions started many, many years ago and turned over to the churches probably 4 years ago to run that, because it's actually run through the churches, where they've got both now a men's and a women's program that can house up to 25 men and women per night in a church, and they generally tend to rotate those through several churches. Those are run on the peninsula again right now. I understand with COVID, they're run and sheltered in place at particular churches for a period of time. But that's an overnight program. It helps to feed and house people overnight, and then they're generally out on the streets the next day during the day. So that's the iHelp program. Salvation Army also runs a 60-day emergency shelter for families. They have one location in both Seaside as well as in Salinas. And then lastly, Victory Mission is located right here in Chinatown as well. I understand they have about 70 beds. Is that right? For men, right? Single men primarily. So, and they get fed, sheltered, and they can continue to come back each night. So.
And I think one of the beauties of the shelters is that we all work together, because we can't all do it on our own. So we have received referrals from those various entities, as well as us reaching out to them. So I'm happy to say that iHelp did take one of our females in a couple weeks ago.
Great.
So we are always in constant contact with them to see where they can go to and what services they can provide for them, as well as them calling us whenever someone needs a bed to stay as well.
Terrific. And I might mention Gathering for Women is a day program for women on the peninsula. It's located in downtown Monterey area. Services about 50 women who, by the way, this is something we talked about earlier. We have this unfortunately growing segment of single elderly women who are either getting priced out of their apartments, they might be on fixed income, etc., where they're either ending up on the streets or in a shelter, and housing for them is becoming extremely difficult, right?
Yes.
And getting them placed and permanently moved on to something else. So this is a problem we're going to have to solve as a community, and we're going to have probably low-cost housing in a community that helps support those women, that growing segment of the women. So terrific. Well, thanks for that update, Christina. We want to understand a little bit better about shelters. How do people actually, number one, find out about shelters, or what are the criteria, if you will, for entering into a shelter? And then how long can they stay there? Talk a little bit about the wraparound services. So give us a picture of how the shelters are run, how people get in, how they stay, and then what happens upon departure.
I think the biggest way that we get people to come into our different centers is by word of mouth. So somebody who's stayed there before, somebody that knows somebody that stays there, will refer them. We also get referrals from the county, from the city, from different organizations throughout Monterey and San Benito County. Mm-hmm. We right now do not have a limit of stay for the actual shelter portions, except for the DV shelters, a little bit different, so I'll talk about that after. Mm-hmm. Our Chinatown Navigation Center and our Home Resource Center are unaccompanied adult-only shelters, so you have to be 18 and over to be able to reside there. Okay. Our Salinas Warming Shelter also does single males and single females, but we also have families. And because we have families, we have to make sure we do our due diligence and do all checks, including our 290 sexual offender check, to make sure that everybody is safe. If we do come across somebody who is found on Megan's Law Registry, we do let them know that what the other shelters will take them, and we usually send them off to Victory Mission, because they don't do checks for them, and they're an all-male facility.
Okay, good. So that's a good differentiation. So people might ask, boy, are people safe there? Are there any exposures they might not know about at a shelter? But so we do that protection. We also do that with the COVID checks, right?
Correct.
We make sure that people coming in have temperature checks when they're first coming in. Are they quarantined for a period of time, in essence, or? So
what we do is when someone comes in, the first question we ask them is if they have been tested. Mm-hmm. If they tell us they have not been tested, then we ask them if they have exhibited any of the symptoms that may be COVID related. Mm-hmm. If they tell us no, we still do the temperature check. We still talk to them, and then we actually assist them in making an appointment to get tested. Good. We give them a certain amount of time to go get tested. We let them out to get tested and come back. If they have been tested, then we ask them for proof of their test results, mm-hmm. so that we know that they have tested negative. And we're getting pretty good turnaround time on those test results, with cooperation with the... I know that's been a challenge a little bit, but the health department is trying to step up. The Health Center stepped up, so there's
There's a little bit quicker turnaround, I understand, than has been in the past.
Yes, it used to be a 2-week turnaround. Now it's about 7 days.
Okay.
The appointments were also about 10 to 14 days out. Now they're only about 3 to 4 days out.
Okay.
So we kind of make accommodation for that as well.
Yeah.
For our DV shelters, to enter our DV shelters, you do have to call the hotline.
Okay.
You do have to let them know what's going on. They ask questions, and then if there is space available, they will bring you in after they go through their questionnaire with you.
Okay. So couples can't come into the shelter typically, right? Or are they excluded, husband, wife, from coming into the shelter? Or do we, at this time, we actually can accommodate if we have room?
Yes.
But typically, they're not the target audience, if you will. So we have families, we have single males, single females.
Correct.
That are primarily the audience using the shelters. Okay.
Yes.
And is there a restriction on timeline on how long they can stay in the shelter?
So I know that the domestic violence shelters have, I believe, a 90-day stay.
Okay.
At our current shelters, which is a navigation center and the home resource center and the Salinas Warming Shelter, we currently do not have a length of stay. And especially with COVID right now, we are really wary on letting people leave if they have nowhere to go, just because we don't want them or their families to be exposed to it.
Right. Yeah, and I know countywide we'll talk to some of the other agencies in future webcasts and so on about the COVID impacts, but we've had tremendous effort put forth to trying to protect particularly the very vulnerable homeless that might have some pre-existing health conditions or things like that. There's a whole home key program in hotels where a number of people are being sheltered, I think close to 150 as I understand, at least on the peninsula and even more in South County. So there is some effort to try and get as many people sheltered as we can, but the protections are vital as well to those that are in the shelter, so we don't get outbreaks or undesirable results there.
Yes, and we do let them know that every time. So the Salinas Warming Shelter is set up in a way where the showers are outside. So anytime they leave the front 2 doors and they come back in, they have to be temp checked. They have to sanitize their hands, and we check their belongings. And we let them know anytime they're out of their room in any common area, they have to wear a mask.
Okay. So they're not actually showering outside. They actually have
In a trailers
showers
outside.
Oh, good. I was worried that they were out in the parking lot taking. No, I really wasn't. But I wanted to make that clear that was a service that actually had to be added, especially with a longer length of stays and everything else in the shelter. So.
Yes.
What happens with feeding, food stuff that comes there? How is that provided? How about wraparound services? What kind of services are provided to people that are at the shelter to help them both continue to progress towards housing ultimately, but also self-sufficiency and things like that? What do you provide in the shelters to help that?
So we do have meals that get brought in. I know that in San Benito and the Chinatown Navigation Center, they have this awesome organization, and I believe Valerie does as well, named Martha's Kitchen out of Santa Clara County. They provide food trays on a weekly basis, absolutely free to be fed. We don't have that same accommodation at the Salinas Warming Shelter because we don't have a kitchen facility. But we get food Monday through Thursday from Victory Mission for dinner, and then the churches and church groups bring us meals on the weekends. And then we have great partners such as yourself, Eric, through your
feeding program,
through your feeding program, as well as the United Methodist Church that will bring us sandwiches, snacks, breakfast food, and items. We had a lady that was bringing us breakfast every morning. We've had the school district bring us lunches for kids and breakfast for kids. So we really get an abundance of food coming into the center we're able to provide 3 meals a day at a low cost or no cost at times.
That's terrific. And then what other services are there? Do we have case management help so people can set goals and find work and get connected to housing? That's part of our services as well?
Yes. So in Chinatown and in the Salinas Warming Shelter, we'll be getting housing navigators. Down in San Benito, it's set up a little bit differently. So the county has those housing navigators set in place to help people find housing. But we are looking forward to getting people housed and put into permanent housing. We've made contacts with Cecil to help us get people onto the vouchers for the homeless.
So Cecil helps oversee the Section 8 housing vouchers along with the Housing Authority.
Correct.
That helps subsidize the rent for people.
Correct. And then also Dorothy's Place has helped out as well with the set-aside vouchers to get people signed up and able to receive a voucher.
Okay.
We also do a lot of phone calls for people, assisting them with getting linked up to the proper services. We've had really great success in having therapists, the school district, and other agencies coming into the Salinas Swarming Shelter to meet with them.
Terrific.
So that they're not having to leave and take all their children with them. They're actually coming on site to provide those services for them.
Great. That really helps the families, doesn't it, just to stabilize.
Yes.
So Christina, give us in 30 seconds some of the key successes you've had with the shelters in terms of some of the objectives we're trying to achieve with getting people housed, fed, and employed. What are some benchmarks we've been able to achieve?
So normally our length of stays at the shelter is anywhere from 60 to 90 days. We've actually been very successful in helping people find housing out at the Home Resource Center. With linkages that we have out there with the county, we're hoping to get those same type of results here in Salinas and in Chinatown. I know that in Chinatown, they've been able, since they've been open for 6 months, they've been able to house 3 people. So that's actually really great considering the location where they're at.
And that's about half the people that have stayed here, right? So,
Correct.
okay.
Correct. We're also I'm also happy to say that we're giving a lot more nutritious type meals, and we're also able to get more donations brought into the center, which is reducing our bottom line costs when it comes to supplies and other items that are needed.
Excellent. So we're getting people housed pretty quickly, as quickly as we can, even in the midst of COVID. We've had several families I know that have moved out and into permanent housing. We've had good nutrition. We've had a lot of community support, which is very much appreciated. How's the overall attitude of the people staying there?
At first, it was kind of challenging because it's hard to be sheltered in place, especially when they're not able to leave anywhere unless it's essential services. But now they're a lot more happier. They now understand why we're putting in certain protocols, and it's just not just us, it's everywhere. And it's like we try to tell them we can only control what we can inside the facility. Once you leave the facility, we can't control if someone, wiped down that washer that you're just about to use. So they're starting to understand why we are doing it, and we are slowly lifting restrictions so that they're able to do more of their own things.
Great.
Without having to be monitored all the time.
So every time I visited there, it's always been very upbeat. The kids are playing and happy, which is amazing given the shelter in place. So congratulations. It's good to see the shelters being used effectively. And again, our biggest need is housing, right?
Yeah.
We're short on housing everywhere. So the more we can build there to help people move on, that'd be great. So. Well, let's flip gears a little bit. Valerie, it's time to get you engaged in the conversation. So respite care may be a brand new concept to anyone listening in on this. And tell us what respite care is. Why did we start the program? It's been in place since 2016. Tell us a little bit what it is, who's been involved, and kind of where we are today with that program.
So Central Coast Respite Center is recuperative housing. Typical stay is 30 to 45 days. And recuperative housing is essentially giving or allowing a homeless person the space, a clean, safe space to rest and recuperate, while also allowing them the opportunity to heal and connecting them to social services, care coordination, housing navigation.
So these are people coming out of an acute care stay at a hospital?
Yes,
very
so
typically.
they had to have had a recent stay at one of the 2 major hospitals in Monterey County or a skilled nursing facility.
Okay. So the program started with actually the three primary hospitals
Right.
participating with Natividad, Salinas Valley, and Community Hospital. And Salinas Valley is at this point in time not participating in that program, but it's a housing program that essentially allows people after an acute care stay to recover for whatever period of time they need to get back to health, and at the same time connect them ideally to housing resources,
Providing
to
case
family,
management
to case
services.
management, all that. Great. So. And there's 6 beds currently in the existing facility. Tell me a little bit about when people are staying there. What are they working on personally to get better, and how are we helping them again to move on so that they're housed after the fact?
So one of the main goals that we have there, obviously, is their health, number one. So they're there because they had a recent stay in the hospital. They need to they're healing from fractures, they're healing from after surgery, that kind of thing. Okay. And during their time there, again, their health is number one. We make sure that they're getting to and from their appointments, so we provide transportation. We also make sure that they're getting connected with their primary care providers, assisting them obtain their meds from their pharmacy, and as well as obviously helping them improve with their income and housing, of course.
Good. So if we're helping them ideally find employment if they don't have it, get
Right.
connected if we can, or at least to work with employers so they can get back to work when they're ready to do so. Good. There's a huge network of respite care facilities across the country. I think we're probably over 100 now nationally, a whole national homeless healthcare agency that actually helps put these programs together and get them up and running. And I was on their advisory board for a while, got to see some of the different models that are out there. We're at one model, which is probably a low acuity kind of model,
Right.
so we're not dealing with IVs or things like that at this point in time. But there's a push to potentially expand and get into even more medical services with, for example, Central Coast Alliance for Health,
Right.
who runs and oversees the Medi-Cal managed care programs for this county, for San Benito, for Santa Cruz County, and so on. How would that vary a little bit, and how might that expand the ability to serve even more people who are medically frail or who might need some services in the future?
So we're obviously or always looking to expand, but I think switching from a medical model or not medical model into a medical model may will assist more people, helping them get to a more stable place, I guess.
Okay, so it brings in resources like physicians and nurses that can again handle a higher acuity of patients. I know one thing that CCAH, Central Coast Alliance for Health, would like to do is actually potentially take some patients from skilled nursing facilities.
Right.
And when they're ready to step down from those into perhaps a lower acuity situation where they can be managed but also connected to housing, that's another way to expand, I think, and open up more broadly some services to the community. So Valerie, obviously there's some cost associated with running these types of programs. So give us an idea, number one, how they're typically funded and how our program is funded. Secondly, what's the motivation behind the hospitals being involved in programs like this, and potentially Central Coast Alliance for Health, and then talk a little bit as well about the housing connection, because that's a really important piece of this as well, as we have obviously time when people are staying with us to get connected with housing. So give us an idea of how these are funded, what the motivation is, and then what's the housing success we've had.
The Central Coast Respite Center is funded by CHOMP and Natividad. We are also looking into funding through Central Coast Alliance for Health. So one of the main reasons, of course, the hospitals would be interested in a respite care program. They want to reduce ER visits and as well as reduce admissions.
Mm-hmm. Readmissions, right?
Yes, readmissions.
So typically a homeless person that enters into the ER and has an admission to the hospital, they have to have surgery, often won't have a source of payment, right, to the hospital.
Unfortunately.
So, and all the hospitals are required to have sponsored care, but if they're keeping a patient in the hospital that doesn't need to be there any longer, they need to recuperate, but they don't need to be in an acute care setting.
Right.
Putting them in respite care lowers substantially the cost to the hospital, as well as you talked about, really impacts the readmission rates, right?
Mm-hmm.
Readmission rates we've seen nationally go down by about 2/3
Right.
for patients that are part of these programs. So very often homeless individuals will use the ER as their primary care
Right.
provider, which is not a good location, right, or even a cost-effective way to use or to access healthcare services. So both of those reduce substantially the cost to the hospitals to participate in these programs, which they highly appreciate.
Yes.
Why would a healthcare payer like Central Coast Alliance for Health, beyond just their great mission of whole person care, why would they be interested as well? What kind of cost savings would they achieve in this equation?
So I'm sure that a provider like Central Coast Alliance for Health would rather, pay to have a program like this as opposed to having to pay a stay in a hospital for one of their members.
Okay, so they achieve the same benefit the hospital
Yes.
does as a
At a
payer,
much-
at a much reduced rate.
Exactly.
Right. So good. It sounds like a win-win-win for everybody. What's been the success rate on some of the housing stuff? I know we were just looking at some data together recently.
Yes.
What's our success in getting people housed, which is also a primary purpose of this?
It's definitely between 50 and 60% getting them housed. So during their time there, again, with case management, they're connected to social service benefits, helping them improve or increase their income, and then that allows them to focus on finding housing.
Awesome. So you talked earlier about potentially migrating to a more medical model, which would
Right.
actually open up also the opportunity to potentially take more people into the program too. So I know we are looking at not only filling our current location, but maybe even expanding to Salinas somewhat in the future if that avails itself. So great program, key piece of the continuum of services.
Yes.
For homeless. It meets a very specific niche, but it's something that's really valuable to the community.
Very needed.
So thank you. So this is a question for both of you. And there's a lot of misperceptions about homelessness, as we know in the community. One of the big ones is people think automatically if people are homeless, they're dealing with drug or alcohol abuse and probably mental health issues, right? Statistics show that probably only about a quarter of our homeless population actually has severe mental health issues where they might need some psychiatric intervention or medications and so on. Almost everyone's dealing with depression, and I have to admit, if I was on the street for 2 nights, I'd be dealing with depression. But that's normal for anyone that's been on the street for some time. And the other perception is the drug and alcohol use. There is drug and alcohol use, sometimes together, often independently. We, I think from statistics, know that's probably around 40%, maybe 50% of our homeless population might be struggling with that, whether fully addicted or just simply occasional users. So I want to talk about what kind of services are available to help service those needs, both inside the shelters but also in the community at large, some of the agencies that are doing that, and how readily accessible are those services to people that help them again in their road to recovery. So maybe you start, Christina, what are some thoughts about, again, the behavioral health and the recovery services that are available, and how do you connect with them and use them?
There in San Benito, there's very limited services in regards to behavioral health services, as well as residential treatment services. For anybody that wants to seek those types of services, have to go through the county behavioral health system, which may take up to 6 weeks for them to be seen.
Okay. In San Benito County.
San Benito County. For anybody that needs residential type treatment, Sun does have a women's only facility that they just were able to open up again in July. Okay. But for males, the only thing they have out there is a sober living environment, and that is after they have come out of some type of treatment. So most treatment options for males is here in Monterey County, okay, or Santa Cruz County, Santa Clara County. But the unfortunate part about that is that they have to wait about 60 days to get their Medi-Cal transferred in order for them to receive any type of services. We do have a great partnership with Sun Street Centers. They are amazing. They do take a lot of our guests into their services, and they work with them to try to get them to where they need to be in order to be able to go back and be productive in the community again.
And Sun Street has both outpatients or out, I guess we call it outpatient.
Yes.
and residential programs.
Correct.
Depending on the need and the severity of the issues they're dealing with.
Yes.
Okay.
And I know they have services in San Benito for women, and then for people here in Salinas, and they also have their King City side as well.
Okay, good. And then where does county behavioral health come into the picture?
So for San Benito, we do refer over and let them know that people do need services. We work closely also with the Whole Person Care down there in San Benito as well. They're right next door to the shelter. So that has worked out and has helped us get people into services that are needed. Behavioral health is a little bit different. It is run by the county, but the wait, and also COVID has also affected that as well. So they are doing a lot of work from home type of services, Zoom type of services. Some guests don't want to be on a Zoom to their doctor. It's just not
personal
the way they want to do it. Yes. As far as the drug and alcohol portions, there are like Zoom classes online.
Sure.
We let them know about the different AA meetings that they can participate in over at the centers to try to help them get to where they need to be. The other thing I've noticed is in our unaccompanied adult-only shelters, we've noticed that the ones that suffer from addiction and from mental health is a lot higher than what I've seen at the Salinas Warming Shelter. It's basically our males.
Sure.
Suffer from a lot of mental health issues.
So actually where people are located sometimes in the community determines, or they tend to migrate to perhaps other homeless that are in the same plight they are. Yeah. Chinatown, for example, is often seen as much more chronically homeless, males in particular, but females as well. The Salinas Warming Shelter tends to be more family, people that are wanting to get back on their feet, that appreciate the services and so on. Same thing in the DV shelters. So there are actually different categories, if you will, of need and types of homelessness as well. So. And
it's also hard sometimes to, we try to put people on routines to take their medications. And the unfortunate part about psych meds is if you miss one dosage, it takes another 10 days to start working again.
Catch up again.
So every time they miss a dosage, it's starting all over again.
Yeah, yeah.
With people. And then sometimes we have people that want to self-admit themselves under a 5150 hold, and that is done with the police department, and the police department assesses. So even if someone has that kind of need, the police officer may say, oh no, it's not severe enough,
Right.
so we can't take them in.
So 5150 is an arrest or restraint, rather. They've been to the hospital for mental health issues.
Yes, and they could be
and-
put on a hold for up to 72 hours if they get evaluated by a behavioral health specialist.
So Valerie, what are you seeing with the clients you're serving, the guests you're serving in terms of behavioral health and needs and connection into some mental health services?
So I would say definitely in Monterey County, and I guess now in San Benito County as well, there is a lack of mental health services. And again, not every single homeless person is going to have mental health, but the ones who do need to be connected to these services. And if there are people who need continuing care, that's where that need comes in. I would definitely also say that there is I guess people who, or again, homeless individuals who struggle not only to just see their primary care physician, but to also take into account my mental health as well. So a lot of them may put that at the back of their mind, no, it's not as important as my physical health.
Sure. So I suppose that could be an issue too, if you've got residential programs in Santa Clara or Santa Cruz, but the person is homeless in Monterey County and potentially connected even loosely to family or to friends locally. It could be tough to also get the family support and some of the community support that you're used to, at least if you get shipped out of the community for a program outside of the community. So it's critical, if we can, to have those programs locally and enough of them that we can actually help people recuperate. So thank you very much. It's great to be with you. I appreciate all the great work you're doing, the heart you have for those that are the least of these in our community. Really appreciate that. Just closing thoughts. We hope, again, you all learned a little bit more about homelessness and shelters in our deep dive into this topic today. I want to, again, as I have last time, challenge each listener to take to heart what they've learned and think about ways to ask questions and to learn more about this topic and how can I become more engaged as a citizen in helping solve these issues. So we look forward to seeing you in our next webinar, if you will, that will probably be coming out in late September, early October. Our October theme will be around domestic violence, and that's Domestic Violence Month, so we'll have some really great guests that deal day in, day out with those shelters and those populations. And we very much appreciate you joining in, and thank you again for being part of the solution.
Thank you.
Thank you.